to Community Insight. I am your host, Reverend Dr. Rodney Coles. Today, we're here sharing resources and information in our community. And right now, we have a special guest on our show, Ms. Brentley. Ms. Brentley, welcome to the show.
Thank you. Honored to be here.
Now, Ms. Brentley, explain exactly your ministry, the mission, what exactly do you guys do?
We are a free statewide prescription assistance program. We're the North Carolina Drug Card, and we work kind of like yourself in communities. We go into the community. We work with nonprofit organizations, medical centers, clinics, free and income-based clinics, halfway houses, homeless shelters, food banks. We go into the community. Our motto is where the need is where we try to be. So we go into the community to try to find people who are getting resources, perhaps from other organizations, to try to provide our program as a resource for any prescription medications that they need.
Now, who's qualified for that kind of program?
Pretty much everybody. That's the beautiful part about it. It is a free statewide program, and we have partnered on the pharmacy level. We have over 68,000 participating pharmacies, so all your major chains, CVS, Walgreens, Walmart, Rite Aid, all your major chains participate, and we provide the cards either digitally or a physical card through various routes, which we can talk about later, to the patients, and they present the card with their prescription at the pharmacy or with their refill at the pharmacy, and they get to access an in-network type of pricing, so they get to save a lot of money on the prescription as opposed to paying full retail. And it's good for everybody, anyone in the community, whether you don't have insurance, if you do have insurance but you have drugs that are not covered, perhaps you have a plan where you have a high deductible and have not yet made your plan's deductible. If you have a Medicare Part D and you have a coverage gap, also called the donut hole, medications that are considered cosmetic, over-the-counter drugs that are written for prescription, that many times insurance won't cover because they're considered OTC. Even veterinarian written prescriptions. Oftentimes animals need human meds. And so if you have a dog, which this actually happened to me, we had a dog and he had seizures, and so he had to take Dilantin. Well, Dilantin is not an animal med, it's a human med, so it's kept at a human pharmacy. So the veterinarian writes the prescription, and you go to your local pharmacy and fill it for your animal, and we can even help you save money on animal meds like that.
Wow, we just had someone recently. We haven't had the pet pantry up here. Yeah, we work with a pet pantry.
Yes.
But I'm meeting with them. We do a lot with food with them. You just hit the key point, even helping our animals.
Yes.
We were talking about on the last show, one of the shows, speaking of how animals is our friends and how
Oh,
people use animals. And one lady told me, listen, hope my animal ever talk 'cause I gave her all my secrets,
I,
you know. And to hear that is a program that even with the animals, that's the first time I've ever heard
yeah,
something,
yes, you
something
can do
like that,
that.
you know. Uh, so what I'm hearing from you is that anyone is basically qualified
Yes,
for that. So even if the person is a veteran and they can qualify
yes.
for it, and if they're senior citizens, they can qualify for it. Let me ask you a question. And sometimes people have that mail-in prescription.
Hmm.
Do you have that where they can qualify, where they can get the discount and it be mailed to
We
them?
do not have a mail order
Okay.
pharmacy. And really that's kind of a benefit. Mail order pharmacy obviously has its perks, but it also has its drawbacks with anything. And that's one of the things that the pharmacies like about our program is we don't take the retail customers and send them away to mail order. We keep them at their hometown pharmacies so that they have easy access to their medicine. I was a technician for 12 years and can't count the number of times that people came in. Their medicine didn't come from mail order. They're out. It's been 2 or 3 days and they have no blood pressure medication. So it has its drawbacks. So we again, it's a community-based
Mhm.
program. We try to keep the citizens of the community in their community pharmacies.
You know, I like what you just say that because you touched on something again when you say keep it in the community. I
We try.
actually believe, you know, when you spending any type of money, you know, paying tax to that community,
Absolutely.
because we have people that's working in that community looking to have that pharmacy
Exactly.
open for them. So that's a key thing.
Well, and when pharmacies lose customers, one of the first things to go are the technicians' hours. And
Mhm.
again, I was a tech. I can attribute to this.
You could understand.
I was cut to 32 hours and not a minute more once. And as a single
Wow.
mother of 3 children at the time, that was painful. Those additional 8 hours, I mean, that was daycare money. That was gas money. So, yeah, it's very hard. And like you said, the communities need those pharmacies to be open because if you need an antibiotic, you can't send that to mail order and wait 3 or 4 days. You need that now. You need it yesterday, usually. So that's what we believe in doing is trying to support our local community pharmacies, the technicians, the staff, the pharmacists, the whole thing, and keep the patients locally as well. That's one of the things that is really great about the program is on our website we have a medication pricing tool where the patient puts in their drug and the zip code, and it will actually give them the prices in that zip code so that they can comparison shop and find a pharmacy close to them to get a good price and keep them as close to home as possible.
You know, Ms. Brennan, I'm going to share this. You know, there's so much that's happening in our community, in all communities, not just in the eastern part of North Carolina. We are losing jobs. And one of the things some folks can't even retire because they got to make sure they have at least part of the medical right now. They need prescriptions and the prescription drugs. And if they don't have that, someone help pay for it and make it so hard. But just hearing your program is an asset to the communities to have understanding that there's help here
Yes.
that can help you
Mm-hmm.
get this drug card, pay a similar, a little fraction of what need to be paid. It's probably a pay scale
Mm-hmm.
that you can still get your medicine. I think that some folks are dying because they can't get the medicine.
If I had a nickel for every time that I watched people literally choose between groceries and medication, or how many times myself, my colleagues, pharmacists that I work for would take the money out of their pockets and pay and buy people's prescriptions. I've done it. Everybody that I've worked with, we've all done it, because you see a person in a situation where they need this medication. I mean, this is not, it's not cosmetic. This is a heart medication, or they've just had surgery or a tooth extracted, and they need an antibiotic and a pain medication because they just had a tooth pulled and they're bleeding in excruciating pain. They've just dropped $150 to the dentist office. They don't have another $50 for medication, and we've all dug into our pockets to do it. There is a need, and people, sometimes they know about it, programs, sometimes they don't. Then you get so many different various cards and programs floating around. People don't know which ones are safe, which ones are HIPAA compliant, what to use, which one's going to save me the most money, which pharmacy can I go to, and it just becomes very confusing.
Wow. Let me ask you, if you're a family, like let's say I'm a husband with a wife and have 2 children, which I have a few more.
Me
Yeah.
too.
Amen. Thank you for the blessings. Um, is there something like a family
Yeah.
coverage?
Absolutely. Everybody in the family can use it. That's one of the things that's really great about this. I had a phone call on the way over here. It was a woman. She had gotten my phone number from the Department of Social Services, and she called me. Just gone through divorce. Her children turned 18, so she was losing her health insurance, and she had 3 medications. One of them was a seizure medication that she needed help with. So she called me. I went online. I priced her medicine for her, and from our website, I was able to text her a digital card to her phone. So I said, now, you, your children, your husband, ex-husband, your mom, anybody can use this. We, again, it goes back to the security, the privacy, and the HIPAA compliance. We do not assign an identifying, like an ID number to people. Our partnership is done on the pharmacy level, so you can use any ID number, doesn't matter. It's any random digit. So you, your wife, however many children you have, and your parents can all use the same card, and the pharmacy will just assign a random ID number to them. So if you don't have access to multiple cards, you can all just snap pictures of it and share. You can go online and you can email it, text it to yourself, download it to any type of digital device, or you can pick up a physical card at various locations throughout the state as well.
So you said to me, I'm gonna wait 7 to 10 days in the mailman to delivery something that I could
The
get it
woman
right on
that
my
I spoke with on the way
smartphone
over here, she's probably at the pharmacy filling
and
your
get
prescription
that
right now.
information. That is really good to know that we
Yes,
have that type of fast service
we try.
on to be able, and listen, it's not just for the family. So if you got your cats and dogs, remember
That's right.
they could get the shot, you to get the medicine as well. But let me ask you this question here is, you're not just in the eastern part of North Carolina, and that's what we want everyone to know. And if you also can share, we're going to be still talking, share your contact information.
Of
Because you
course.
let us know where you at. 'Cause some people might be watching this broadcast. Well, it's just in Eastern North Carolina. Y'all are.
All over the whole state.
Could you tell like you all
Yeah,
over the state? Give us a
we
little
are
bit.
statewide. It's a statewide program. Um, there are 7 of us that work the state. We have 6 local representatives on the ground, and then myself. And we're all over the entire state. You can go online at www.northcarolinadrugcard.com, just one big long word. And you can download and print your card from there. You can, there's on the website, there is a way, like I said, to email the the card, text the card, download the card, or print the card. So you've got various options and ways to get it, and it's all over the state. And should you need to go out of state, maybe to visit a family member or to go on vacation, but you have a prescription to fill, you can go to any CVS nationwide and use your North Carolina drug card, even if you're in Washington or Alaska or even Puerto Rico.
Wow. So you have such a, it's not as a ministry to me. Look, to me, it's more of a program ministry where something that can help our community and other communities. That if they have, once they get a prescription, up to this prescription is pretty high now.
Oh my gosh, I'm telling
I
you.
mean, I had a couple of two pulled out, and I went to my, if I didn't have a insurance plan,
Mhm.
it's sad that you can't. And you're right. Some folks is deciding whether should they take the medicine to live or eat food to live. I mean, where, where do you go?
I do a lot of research for things in my job, and I do some writing and some articles and things. And one of the things that I was reading about, which I found so sad, was the striking percentage of people, and this is done through the NIH and the CDC. This is reputable research. The staggering number of people who do not take their medication as prescribed. They delay refilling it, or they cut it in half. They take half of their dose, or they take it less frequently as they're supposed to. They skip entire doses. They skip days just to space out the medication to make it last longer, so that they don't have to refill it as often, so that they save money. And what's odd is you would think, people think of seniors and they think of seniors with medication, which often is the case, but thanks to Medicare Part D, most seniors have medical coverage. It's actually adults aged 18 to 64 that have the most incidence of being uninsured, not having prescription coverage, and trying to look elsewhere, even going so far as to getting medication from other countries that are not approved by the FDA here in this country, just to save money.
And that's so true. When you talked about the senior citizen, they may have a certain type of coverage that they have, but you have so many folks who's not getting the medicine that they need. Now, I'm not a strong advocate for drugs, but I do know we need them where to help if you have an infection. You can't go out there and wait for some molded bread.
Right.
I think the Al Capone would have been still living if we had some penicillin. But
I don't know if that's a good thing,
yeah,
but
but I do know we couldn't wait for molded bread to help, and there's natural stuff like onions and garlic and stuff, but we know we had to have that, and folks that understand that there's a way they can get the drugs that they need, because everybody's in a very, I was just talking with my wife the other day. I said, it's a shame you got to pay to watch your own TV. That's crazy. I have to pay the cable people to watch the TV. And the time where we just had 13 channels, you had to hang on there with some aluminum foil.
Get up and change the channel.
And
there were no remotes. There were children.
There was children. What happened to the little games you used to play in the street? They do the jump ropes, and we used to play with the skulls, the scalesy, and the spin tops, and yo-yos was some luxury.
Oh God!
If you had
one. I love Slinkies. I love Slinkies. But you could never keep a Slinky more than a day, because I always got it twisted up. But they were sure fun while they lasted.
So we in such much of a new type of decade today that we're in now with the electronic. Just hearing that, even where electronic can get it, because when I was courting my wife, I had to write a piece of paper and it said, would you be my girlfriend, yes or no? And I was scared to even give her the paper. Now I can if in this time I can send an email, a text you, okay, well, I listen to you can act with the phone called you, that wasn't me. And then knowing that the program that you have now for those who may say, hey, I'm looking at this broadcast and, I need to get myself or my family. And let me ask the other question I didn't ask. Do you have to be employed or for anyone? So,
There are no restrictions on this program. That's the great thing about it. And I started to say, and I always correct myself in this, just be a resident of the state. But that is also technically not true. Um, the Carolinas have a very high immigrant population, and there is a high population of undocumented residents. And even for those individuals, they can still use this program if they need help with their medication. Again, we're completely HIPAA compliant and completely private. We don't ask for your name, your date of birth, your social, nothing. So we're just here to help people get medication. We leave the politics to the politicians. Our job is to just help people get medication that they need. So you don't even technically have to be a resident, but no, there are no restrictions, no income, no age, no medical eligibility, nothing. It's just like I said, we have partnered on the pharmacy level to work with them. And so anybody who needs access to the in-network pricing on the medication, they use the card and they get access to that medication.
wow. You hit another point. You hit a lot of points here, Ms. Brentley, I must say. When you talk about the immigrants in our community, I do a lot in helping. And I know that one of our presidents in our area, Evencio, and you just said something key is that even helped them. They probably said that's a problem a lot of times when folks feel, well, I'm not born and raised here, and I don't want to get into the political realm with something something was
Right.
said over natural TV, and now people hiding, not saying they can't get help, but you're saying that we all can,
Yeah.
they could be a part of this.
Yes, and not just that. I mean, and again, like you said, not to get into politics, but not just that. Different laws work different ways, and so do different benefits. But without having certain documentation, people just are not eligible to receive certain benefits, such as maybe Medicare, Medicaid, things like that. It just, I know that stuff varies, but without certain documentation and letters and numbers, they may not be eligible to get that. And then there's also what you said, there's that fear factor, where people don't want to answer questions, they don't want to give information because they're afraid, what might be found out. And again, that's where we come in. We don't need any information. We don't ask any questions. We're just here to help people, and regardless of who it is that needs the help, or how they got here, or where they're from, or what they need the help for, that's just what we do. They can just get the card, present that card, say they've gone to, let's just say anyone has gone to a free clinic, maybe even a church base, because we work with a lot of ministries, religious ministries that have health clinics, either occasionally or regularly through their church. It's part of their outreach. And they'll provide the prescriptions, but then the patient still has to get that prescription at a pharmacy somewhere. So this is a great option for that as well.
Let me ask you another question. Are you willing to go to churches if they listen to this broadcast to do a presentation?
We were at a church yesterday.
Okay, I was making sure
Yeah.
there's some folks looking at this broadcast. I would like to have, I'd like to have her come to my church to explain to the congregation, because a lot of us pastors, sometimes we not the sharpest knife in the
I've
drawer.
never
We're
met
trying to
one.
remember, some things, and I don't mean to picture pastors out there, but sometimes we can't catch all of that,
Right.
and most people don't. So you're willing to do a presentation, and so
Absolutely.
what if, I mean, could you give them information how they could get in contact? Is it the email is best to get in contact with you?
Probably the easiest way, and now this is my work email, so this is for anybody in the state. It's B Manners, BMANNERS at NorthCarolinaDrugCard.com. So it's pretty simple, and again, B for Brittany, B Manners at North Carolina Drug Card. And I always tell people it's Manners, like please and thank you. So, because sometimes people think it's Manners like a big house with an O. So I always correct them. It's
We're going to say
Manners.
it again for 'em just in case. I know some people that probably got the pen and didn't write.
Yeah, well,
Why is it when you try to write a number down sometimes and you grab the drawer and you can't find the pen? When you
the
find
pen's
the
never
pen,
where you put it.
it's not.
I blame
It's
children.
not.
Children.
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 Okay, children got the label that way.
I have 3 teenagers in my house. I blame them for
Oh,
everything. So that's how it works.
you bring the teenagers on.
Yeah, I blame everything.
Oh, wow.
But yeah, again, so it's B Manners, MANNERS at North Carolina DrugCard.com. And that will come straight to me. And like I said, I've got 6 of the most amazing reps on the ground, from Elizabethtown to Wilmington to Raleigh, Winston-Salem, all the way over to Asheville and Charlotte. So we've got people all over, cover the entire state. So yeah, we can come. We work with school systems. We work with churches. We work with religious outreach programs. I'm trying to think. Homeless shelters, food pantries. We love food pantries because a lot of times, people, they just go there, they need a little bit of assistance. And so we will go and we'll help stuff bags. And while we're helping stuff bags, we're dropping prescription cards in the bags. School systems, like when school goes back and kids are sending home, getting all the new paperwork to be sent home. If a school system is interested in having us to send home as a resource for the children's families, then we'll go, we'll provide them, and they send them home with the kids. So our job is to just make this program available to as many people as possible, So any outlet for getting it out there, anybody who wants some, if you just want me to mail you 10 or 15 cards to pass out at will, let me know. We'll get them to you.
And that's good to know because there's over 200 food pantries here in the Pitt County area, and I was just with one of the directors from the food bank yesterday, and they also looking for resources. Because one of the things we do monthly is the food distributing, and I'll be getting back with you because we have at least over 300 people.
I know you
online.
have my email address, so we're
Yes,
good.
ma'am,
Yeah.
I do. And to be able to give them that information because I think that, I'll go back biblical because biblical's always what we need to understand.
You
Is,
know what my favorite scripture is in the whole Bible? It's the one I told my kids to remember no matter what. That which you do unto the least of me, also you do unto me. So I've always told my kids, no matter what you do, if it's just giving a bottle of water, if it's whatever, you think about that, you may as well be doing that to Jesus himself. And I've always done that. And on the flip side, you pick on a child or, you whatever, Jesus is watching. So that, and I believe that. I mean, I try to live that way. That is my favorite scripture in the whole entire Bible.
And I feel that a lot of folks falls as well in that one of the scriptures, Hosea 4:6, that my people destroy because of a lack of that, is that knowledge. People don't have the understanding of what's going on. That's why I truly thank God for this community insight broadcast, which we could get the information to the communities and folks can get involved because I think every food pantry, I believe every church, any ministry or organization, because they need this type of information to know that you can get a drug card which can help your members or people that you helping or serving to be able to get the discount what they need because we need as much resource. I mean, economical. Everybody job salaries is really shrinking, and I don't know whether I'm not promoting this, but there's a book called Rich Dad, Poor Dad. I don't want. I mean, I'm not promoting.
I've heard of it. I've never read it.
Yeah, but it was a really good book, and sometimes it brings in realities that where we at. That we going to school, we're doing everything we need to do, and we're all following the golden rules, but then you get to jobs and corporation because funding they stop, and one of the biggest things that a lot of corporations are stopping is medical. I mean, that is the biggest part. It's like taking meat off my plate. You know what I'm saying? I mean, I'm just going to eat the corn and the vegetables. Yeah, I mean, that's all. But they take that big part off the plate. And people are right now, they're struggling. They're struggling and figuring out, like, how can I get my medicine? I need this. I may have diabetes. They have a certain program. Medicaid is going to only do for a certain period.
And that's a perfect point, not to interrupt.
No,
That is
please,
a
I want
perfect
you to go.
point. People with a lot of symptoms, maybe you have Medicaid or you have Medicare. So you are insured and you have prescription coverage, which is wonderful. But every insurance, from the best to the worst, they all have what's called a formulary. The drugs that they cover versus the drugs that they don't cover. No insurance covers every drug. None. Not the best government insurance. It just doesn't exist. So anytime you have a drug that is not covered by your Medicare or Medicaid, here's just a backup to help you instead of paying full retail to help you save on that drug. And again, as I mentioned, people who have Medicare plans, we're getting into this time of year where people are going to start hitting that coverage gap. And they're going to start, what cost them $50 in copays last month, they're going to walk into the pharmacy this month and it's going to be $300, $400, $500. And what do? I mean, for someone on a fixed income living on Social Security, that's rent, that's groceries, that's whether you choose to eat or to take your blood pressure medication. And I just don't think in our society people should have to make that choice. I mean, it's not like, choosing a frivolous thing over, something necessary. But I mean, medicine and food are both pretty necessary. So this is a good option, to help with that. Some people have even chosen to use the program so that they don't go into the donut hole so soon. Like the less expensive medications they'll put on a card, and the more expensive medications on the Medicare, so that they don't go into the donut hole quite so soon in the year, or possibly not at all. Or for people who have really great insurance and only take occasional medications, but perhaps you have something that's considered cosmetic or it's non-formulary. Maybe your doctor prescribed one drug, but your insurance prefers a similar drug, but it's different, and one doesn't work as well for you as the other, so it's not covered, or it requires a prior authorization, which is a 3-day process usually, and you have to wait, and that doesn't always get a yes at the end anyways. The insurance company gets to decide. So for those circumstances, this can be a backup. You can go ahead and get the medication that you want that was prescribed instead of waiting for a change, and still be able to afford the medication. So that's what I said. It's really a great benefit to pretty much anyone. My daughter, she went to college this year, and she needed something, I forget, and she didn't have a copy of the insurance card with her, but she had worked with me, and she knew our numbers. I said, just put it on there, whatever it was, I forget. It was like $10 or $11. She just walked out with it. It was just, and for me, for that was just convenience, because I didn't want to dig around and find the insurance card and send her a picture. So, even in circumstances like that, sometimes, and even with copays, with people, sometimes you have a flat rate copay of $10 or $15, which is not bad. It's really not. But if you have a drug that's only $6 or $7 or $8, why pay a $15 flat rate copay if you can just pay $7 or $8 and get it that way. So even then, if it's a generic and it's a very inexpensive generic, it's always worth comparing to see which one's going to be cheaper. I mean, I'll save $7 when I can save $7.
Oh, you know that.
In my house with two teenage boys, that's 2 gallons of milk.
Man, forget it. That's a day you probably get rid of that milk.
Do you know, I still to this day go and buy about 5 gallons of milk at a time, and it will never go bad.
I don't know, maybe she would get the cow to the house.
It would have been cheaper, probably. I just don't have the acreage for a cow, but I'm telling you, it would have been cheaper.
Two things, because you said something, I want to make sure they have a clear understanding of this. If I have a job and I'm not, well, I have a job, maybe washing calls, whatever I'm doing, I'm cutting hairs, I'm qualified to be a part of the drug discount card.
Yes,
Okay,
absolutely.
I just want to make
Oh, yes.
sure, because I make some folks may be listening and they may they catch in bits and pieces, and not sure. And so it's for anyone. I mean,
Absolutely.
there's no restriction that y'all can, if they are working, have a job,
Yep.
they can
They can
get this
still use the
prescription
card.
card. Now, I'm going to add one more point in here, and I'm going to need your help on this
Okay.
one here. You know, there's a federal rule here in North Carolina, and, you know, me personally, I think it's wrong.
Okay.
Is that when these gentlemen come out from jail, they cannot get food stamps.
I'm so glad you mentioned that.
All right, I get in trouble all the time.
No,
you know,
no, I'm glad you
I just
mentioned that.
speak truthfully. I'd rather be hated for who I am than be loved for what I'm not. So, you know, they qualify, you know.
Yes. I love that you said that. We actually work with numerous prisoner reentry programs. Because here's what typically happens.
Well, we have to cut the show. Could you give your information one more time? I apologize for that.
No,
I mean, we get on into it. Give your information one more time as we close out on the broadcast.
yes. You can go to www.northcarolinadrugcard.com, or if you would like to email me directly to get more information about the program, possibly to work with your organization, it is B like boy, manners, MANNERS, at NorthCarolinaDrugCard.com.
Thank you.